Well, good morning, everybody. Thank you very much for inviting me to give this short overview on an introduction to physiological measurement. Physiological measurement then is essentially exactly what it says. It's how we measure a patient's physiology. Physiology being how a body is working, how a body is functioning, as opposed to anatomy, which is the structures and organization of a body. So the human body is a very complex system, lots of different organs, structures and systems, all working together to keep us healthy and keep us active. These can include, for example, things I'm sure you know about, how we breathe, how we move around, how we get blood to move in the body, how we eat and digest food, how we see, how we hear, even how our brains work. So clearly, if somebody is unwell, if somebody is poorly, we're going to want to know which bit of their body is not functioning, and we're going to want to be able to measure that. Make sure it's working correctly, or if it's not working correctly, what the problems are and what we might be able to do to help our patients. Now, as scientists and engineers, we're pretty good at making measurements. Making measurements is pretty much a core thing of what we do. So scientists and engineers can have a lot to contribute to this vital world of physiological measurement. So physiological measurement then is making measurements of how the body is doing, how the body is functioning. And these can be very simple measurements. For example, just taking the temperature of a patient with a clinical thermometer, or they might be much more complicated, much more complex systems for how we might measure how the heart is working or how the brain is performing. They can be taken, these measurements, in a wide variety of medical situations. And many patients will benefit from physiological measurements. And we're going to look at a few of the principal ones in this very brief overview today. These might have something to do with the heart or the bladder, hearing or sight problems, patients who can't breathe very well or have difficulty sleeping. And as engineers and scientists working in this field, we're always looking for new ways to make measurements or to apply measurements in different ways so that we can look after our patients better. And the key thing, I guess, with physiological measurement is we're trying to make a measurement of some part of the body and how it's working. So we use a sensor or a transducer inside the body that looks at that body function, that responds to that body function. It might perhaps be looking at the temperature or the pressure or the flow, maybe the electrical activity in the body, or even how the chemistry of the body is working. And we convert that into an electrical signal. And then with that electrical signal, we can analyze that, we can record it, we can display it on a screen so that the medical team can see what's going on with the patient. And so it's through these measurements that we can try and help our patients understand what's going on in their bodies and support them into healthier life again. So we're just going to have a look this morning, very briefly, at what areas in hospitals and healthcare we might use. And there are essentially two broad sort of categories of physiological measurement. The first is very general. Almost every time a patient comes into contact with healthcare, the doctor, the nurse, the healthcare professional might well make one of these general measurements, which we sometimes refer to as vital signs. And these four key measurements that we make in this general way are temperature, blood pressure, heart rate or pulse, and oxygen saturation. As I said, they're core, they're ubiquitous across healthcare. And then on top of that, there are a number of special ways in which we make measurements on the body. There are lots and lots of these, lots of different clinical applications, but there's generally seem to be 8 main ones, and we'll touch very briefly on those this morning. These are generally associated with special clinics, specialist clinics, and look at a particular part of the body. And as I said, there's 8 of those, and we'll touch on those. So let's start though by looking at those 4 vital signs, those 4 core ones that you'll come across in almost every health application. And perhaps the most important, certainly the most widely used across the whole of health, would be temperature. We know ourselves if we're not feeling well, that one of the key measures is our temperature. Have we got a raised temperature? Are we running a fever? And so how do we measure that in a clinical sense? Well, actually, the old-fashioned way of measuring that we've done for many, many, many years is to use a mercury thermometer. Mercury thermometers are actually very accurate and a very good way of taking a measurement, but the device itself is delicate, it breaks easily, and mercury is very poisonous. So we generally don't use mercury thermometers in healthcare practice. But you'll have seen a mercury thermometer, you'll have seen how it works. You place it in contact with the body, usually under a patient's tongue, sometimes under the arm, in the axilla. Leave it there for a little while to acclimatize, to reach the same temperature as the body, and then we simply read off the dial. And like I say, not widely used in modern healthcare. They tend to be replaced by two other devices. One is a probe thermometer, and a probe thermometer utilizes a thermocouple. And you've probably come across thermocouples in other areas of physics and engineering. It's a very widely used way of measuring temperatures, and it's essentially two dissimilar metals wound together, which respond differently to temperature and produce a small voltage. And a probe thermometer like this, using a thermocouple, widely used to measure patients' temperatures, and like the mercury thermometer, one has to place it in contact with the temperature, so under the tongue, in the axilla, leave it there for a little while to acclimatize, and then we get an electrical readout, a digital readout of the patient's temperature. They're very accurate, widely used in hospitals, but they do have to be left there, and they take a minute or two to respond. So a quicker, simpler way to measure temperature is using a tympanic thermometer. That's in the bottom right-hand diagram photograph on the screen now. A tympanic thermometer works on infrared. We shine a small amount of infrared on the tympanic membrane of the ear, and the amount of light that we get back, infrared light we get back, is related to the body temperature. Very quick and easy to use, but not desperately accurate, not as accurate as a probe thermometer. So they're used a lot in hospitals, but when we really need to make an accurate measurement, we would rely on the probes, not the tympanic. So that's temperature measurement. Perhaps the next most important, most widely measured physiological parameter in the body is the blood pressure. And I'm not going to spend ages talking about how the cardiovascular system works, but you will know that the heart pumps blood around the body. It's got a number of phases, but we can talk about two broad phases for the moment. The systolic phase of the heart, when it's pumping the blood around the entire body, that's a high pressure to push it around the whole body. And then the diastolic, sometimes referred to as the rest cycle, even though the heart's not actually resting at that point. So we get that pulse, two different pressures. Now we can measure that pulse ourselves. If you take your own pulse, if you place your fingers, like in that second diagram, across the artery, if you place your fingers really, really lightly, so that you're hardly touching the skin at all, you won't be able to feel the pulse. And then as you apply more pressure in your fingers, as you slowly increase the pressure, you'll start to feel the pulse. Then if you carry on pressing harder and harder, you'll reach a point when you're pressing so hard you completely occlude the pulse, completely occlude the vessel, and so you can't feel the pulse anymore. And those two pressures, when you first can feel the pulse and when you've occluded it completely, are the diastolic and the systolic heart pressure, blood pressure. And we can measure these more accurately with instrumentation. So in the top right-hand diagram, we can see the old-fashioned manual way of measuring. And the best thing to do is to occlude all the vessels with a cuff that we place on the top of the arm. We inflate that cuff really high, way above the systolic pressure, so that the pulse stops. Then when you listen with a stethoscope, you can't hear anything at all. And you gradually deflate the cuff, and as the cuff reduces in pressure, at a certain point when it drops enough, the pulse starts again. And there's a very characteristic sound as the pulse restarts. They're called the Korotkov sounds, and it makes a very whooshy sort of noise as you first hear it. And that, the pressure at which that happens is systolic pressure. You carry on releasing the pressure. At some point, you stop to hear those Korotkov sounds completely, and that second pressure where you reach that is the rest, or the diastolic pressure of the heart. So that's the old-fashioned manual way of doing that, using a stethoscope, and there are automatic machines widely used in healthcare now, which can do that for us. So that's the second vital sign that often hospitals have. The third and the fourth were heart rate or pulse, and oxygen saturation. How much oxygen is there in the blood as it's in the body? Again, two very important parameters healthcare staff to be aware of when looking after patients. Unfortunately for us, there's a very easy way, simple technique for measuring both of those with one instrument, and it's known as the pulse oximeter. So if you take a light source in that first diagram, and you shine that light to go through the fingertip, or sometimes you could do this with the earlobe. You shine the light through the fingertip, and then the light is absorbed along its path before it reaches a detector at the other end. And that absorption is caused by the skin absorbing sunlight, the nail, the bone, the fat, and of course the blood within that light path. Now the skin and the nail and the bone are all static. They don't change with time, the amount of absorption, but because the blood is pulsing, it does change over time. So if we look at the AC component of the absorption, it pulses in the same way as the blood pulses underneath that light wave. And so we get that light absorption AC signal, and that's very easy to detect from that the pulse. So this device, very quick and simple to measure somebody's pulse. But it can do more than that, because the amount of light that's absorbed by blood changes. The spectrum of absorption changes depending whether the blood is oxygenated or deoxygenated. And the graph in the middle of the picture there shows that difference. So the blue line as it's drawn on this graph shows the absorption spectrum of deoxygenated blood, and the red line as it's drawn on this graph shows the absorption spectrum of oxygenated blood. And of course, your blood going around through your fingertip will be a mix of those two components. If we pass light through the finger then at two different wavelengths, and in this example we're showing that in a red 660 nanometers and an infrared 910 nanometers, the amount of absorption on those two wavelengths against those two different spectrum, oxygenated and deoxygenated blood, gives us a difference. And that difference, with a clever little algorithm, can tell us the percentage of oxygenated blood that we've got. So a simple device, the pulse oximeter, can give us both the pulse, a very important feature, and the amount of oxygen in the blood, and that's the pulse oximeter. So those are the four most widely used physiological measurements, I would say, in healthcare: temperature, blood pressure, pulse, and oxygenation, and that's how we would measure them. But there are a huge number of more specific, more specialized measurements that we would want to make on patients, depending what we think is wrong with them, depending how we're trying to look after them at that time. And there are 8 really key ones. There are lots and lots and lots, but there are 8 really key ones which have specialist clinics. And these 8 are audiology, looking after making measurements on the ear, ophthalmology for the eyes, cardiology, the heart, urology or Eurodynamics, the kidneys and bladder, neurophysiology, making measurements on the brain, gastroenterology, which is the stomach and the digestive system, how we breathe in respiratory, and then how blood moves around the whole body in vascular. There are special lectures coming up today dedicated to the first 3, audiology, ophthalmology, and cardiology. So I'm going to skip over those in this presentation and leave that for subsequent speakers. So let's move straight on then and look at Eurodynamics or urology clinics. This is not the most exciting, not the most glamorous part of healthcare, but patients who are having difficulty with going to the toilet with urination can be a serious problem. We need to know whether it's their kidneys that are at fault, whether it's their bladder that's not working properly, or whether it's the pipe work, the urethra, and various other bits of tubing that connect that all together. And so it's important to make measurements on that system so that we can identify which bits of it's not working properly and help our patients get better. And that whole process, that whole measurement system is Eurodynamics. And I actually started some of my very early career working in Eurodynamics. And in its simplest form, as I said, it's not the most glamorous, but in its simplest form, we're making pressure and flow measurements on somebody when they're going to the toilet. So, as I said, it's relatively simple. In this little diagram, I don't know if you can see it very clearly in the black and white photograph at the bottom of the picture. And we're literally asking a patient to go to the toilet, to wee into a pot, and we're weighing the amount of urine that they produce during that. We're weighing out measuring that against time, passing it through a differential amplifier, so we're seeing the rate of change, and then we can plot that out on a graph, and that's the bottom green line. You possibly can't see it very well, but that's basically giving us the flow, and that's a hugely important measurement because it can tell us whether or not the bladder is filling, or whether there's blockages, whether it's a muscular thing that's going on. And there's a whole pile of other little measurements that we can make, all relatively simple, but very important measurements to make to see how well the patient is able to get rid of past water out of. So that's Eurodynamics, and then it's an important clinical area. The second one I was briefly going to look at this morning is neurophysiology. Now you will know that our brains are essentially powered, working by passing small electrical signals around the brain. And if we can measure those electrical signals, they're called electroencephalograms, or EEGs. So that's the tiny electrical currents that come when our brain is functioning. And our brain is a fantastically complex system, and different parts of the brain work at different times, depending what activities, what we're thinking about, what we're trying to perform. And so these various different waves, electrical waves that we can measure coming off the brain, tell us a lot about what the brain is doing. How do we measure those? It's a very sensitive system. Because the brain is a sphere, what we try to do is we put electrodes onto the skin of the scalp, and you can see in the photograph, I hope, in a sort of net, which arranges them at very specific points around the head, and we feed them back into a piece of instrumentation, which is sometimes referred to as a head box, and each of those signals from those different transducers comes back into that head box. Some very sensitive high impedance front-end amplification. If you're an electronic engineer, you'd love finding those because it's quite a challenging thing to design. And so we bring them in so that we can measure these very small electrical currents against an often quite noisy electrical background. And the chart that you can see at the bottom there shows the electrical signals coming from each one of those different transducers across the patient's head. And if you're clever, and I'm not, but if you're clever and you work in this field, you can recognize various peaks and troughs and shapes that we get on these signals on the chart, which can tell the physiological measurement team what's going on with the brain. And this can be used to detect and identify a whole range of problems that people might have with brain activity. Most typically, physiological measurement, neurophysiology like this, is used to detect and describe the nature of epilepsy, for example, or to measure the damage that might have been done to somebody's brain post having had a stroke. But it's also used in other areas. We can use this while patients are asleep to identify if there's problems with sleeping and sleep disorders, and we can use techniques like this to see if there's been any damage to the brain, either from trauma or more typically in a hospital setting from a tumour, from cancer that might be attacking part of the brain. So we can make these clever measurements on the brain activity and identify what's going on. But neurophysiology got another use. You'll be aware that the nervous system is essentially small electrical signals being passed around the body. And if your patient is having an operation, let's say a spinal operation, an operation on their back, the spinal cord has a whole host of these electrical signals passing down it. And it's very important that the surgeon doesn't damage the spinal cord during the operation. So the operation might be for some other aspect of the back, but we want to make sure that the surgeon doesn't accidentally damage the spinal cord. So in the two pictures on the right-hand side of this slide, you can see a neurophysiology team doing what's known as spinal monitoring. So they're measuring the currents, the functioning of the nervous system, the feet, in this instance of a patient who's about to be having spinal surgery. And so they monitor that throughout the theatre, throughout the operation. And if the surgeon gets close to damaging or touching those nerves, then the physiological measurement team can tell the surgeon that they're going to cause a problem and make sure that that doesn't happen. So that's important in spinal surgery, but it's important also in face, head and neck surgery, because there's so many nerves in your face. And if the surgeon were to damage one of those accidentally while operating, then it would affect the patient's ability to show emotions, to smile, or to talk, or to wink, or to open their eyes properly. And so monitoring during theatre is a really important part of neurophysiology. So that's that one. Let's move on to the next, which is gastroenterology. And gastroenterology is all about measuring how the body works when we're eating and digesting food. And you might not think this is a big area, but in fact it is quite a significant part of physiological measurement. There are a number of patients that come to us, particularly with swallowing difficulty. So dysphagia is the posh word, which means swallowing essentially, or difficulty, mis-swallowing, unable to swallow properly. Oral pharyngeal is the upper part of the mouth having problems when trying to swallow, and esophageal dysphagia is lower down in the digestive tract. And these are complex systems that have to work in a particular systematic way. We take it for granted, of course, when we're healthy, that we just take a sip of water and swallow, and it all happens naturally. But in fact, it's quite a complicated system that does that for us. And we can measure how that system is working with patients who are struggling or have difficulty with swallowing and digestion. Primarily what we measure when we're doing that is the pressure of the system when somebody is trying to swallow. And the diagrams that you can see bottom right hand of this chart show a pressure map over time as a patient is trying to swallow, and where the pressure picks up in the esophagus, out there where there may or may not be a problem for the patient when they're trying to eat food and swallow. And there's a range of other pressure measurements, timing and flow measurements we can make to help identify any problems that there might be with the digestive system. Another huge area, in fact, in terms of patient numbers, it's possibly one of the biggest physiological measurement areas, is in respiratory, is in how do the lungs work, how do our patients breathe. Certainly in the UK, there are huge numbers of patients who have some form of respiratory distress, some form of respiratory condition that we're trying to treat, that we're trying to manage. Whether that's coronary obstructive pulmonary disease, COPD, whether that's diseases caused by smoking or pollution, whether that's asthma, or a whole pile of other breathing difficulties that patients will have. And so we want to make measurements on how well the lungs are functioning to try and identify what's going wrong with the lungs and how we might be able to help our patients improve that. In its simplest form, what we're doing here is measuring the pressure when somebody breathes out and the flow of that air as they push air out of their lungs and as they pull air back in. So in the diagram, in the top of this diagram, we see a patient with a mouthpiece, and their nose is blocked to stop any air coming out through their nose, so that all of the lung movement is coming through their mouth. And we've got a flow and a pressure meter in the handheld device that you can see being held there. And the graph underneath shows a typical response that we might get when we ask our patient just to breathe normally, and they go in and out, and we get that sine wave of change flow across the graph. And then we ask the patient to really blow out and really try and exhale as much as they can to get rid of all that, and we measure how much they can remove out of their lungs, and then we get the patient to really breathe in as far as they can, and we can see how much they can possibly breathe in. And these are key functions, key parameters that we can measure that tell us how well the lungs are working and what might be going wrong with the lungs the patient is suffering. And there's a range of tests, fairly complex tests in addition to the simple ones. A key area for us is also measuring sleep disorders. The condition known as sleep apnea, where patients stop breathing in the night. Sometimes the patient wakes themselves up when they stop breathing, but sometimes they just stop breathing for quite a long period of time and then just start it, and then do that several times throughout the night. And that can be very damaging to your overall health because you're not breathing properly while you're asleep. So we make these measurements on patients whilst they're sleeping in what's known as sleep, to try and diagnose what might be going on and how we might be able to correct and help our patients get better. So that's respiratory. And the final one I'm going to talk about this morning, just mentioned this morning, is another really big area, and that's vascular. Measuring the flow and the structures that enable blood to go around the body. And obviously blood is hugely important. It flows around the body. It takes its principal aim is to take oxygen around the body, because tissue needs oxygen in order to stay alive, in order to function. The vascular system also takes nutrients and removes damaged areas from. So the blood supply, the vascular system is hugely important, and it often goes wrong. It's a complex system that often goes wrong. So one of the key measurements that we all make in a vascular study, and obviously the vascular system goes all around the body, but one of the key measurements that we make will be ultrasound to measure the flow of blood in the arteries, the vessels that are carrying the blood around the body. If you look in the picture in the top in the center, we've got a screenshot there of a system that is measuring the blood flow in a vessel. And that's being measured by ultrasound. So ultrasound waves will be being passed like in the diagram, the photograph on the right hand side. Ultrasound will be passed through that transducer. It'll pass into the body, and it's doing two things at once in this machine. It's called a duplex ultrasound machine because it does two things at once. The first thing it does is a standard ultrasound picture. So it's looking at the reflections coming back from surfaces inside the body, and the black and white part of the image is showing us the structures that are reflected. So it's the same as echolocation in animals or radar systems, and it gives us a 2D picture. So that's one thing that it's doing. The second thing it's doing is it's measuring the Doppler shift. So it's sending a sound wave into the body. Some of that will be reflecting back up off moving blood corpuscles, red cells in the artery. And because it's reflecting off a moving body, the wavelength, the frequency of the reflected sound is slightly different, and we can see that shift in frequency, that Doppler shift. And you've probably come across the Doppler shift in some of your work in your universities. That Doppler shift enables us to tell the speed that the blood corpuscles are moving. So we've got two pictures at once superimposed there. One giving us the structure to show us where the vessel is. One giving us the Doppler signal to show us how fast the blood is moving. And in this picture, we can see that this is the vessel. The sort of whiter, the brighter the color, the faster the blood is moving. The darker the color is where it's stationary or slower moving against the edge of the vessels. And in this particular example, there's a small narrowing here. You can see the vessel wall, and you can see a small narrowing, which is not good news for our patient, because it means the blood is struggling to get through there, and we might have to do something to sort that out. So that's the sort of measurements that we can make in vascular. It's used in lots of areas. In this particular area, it's probably just a demonstration because that's quite a young patient, but they're looking at the carotid artery, big artery in the neck, which sends most of the blood up to the head and the brain. Obviously a very important measurement. It's often affected. It's often carotid artery that problems with the carotid artery that results in strokes of a patient. And we can do a whole range of other ones. A very big area of vascular studies is to actually look at the heart itself. Not how well the heart is working, but how much blood we're supplying to the heart. The heart is a muscle, and it requires a lot of blood to itself to keep it healthy. And often when those arteries get damaged, we get pains in the heart, we get angina, which is a typical one, and they can ultimately lead to difficulties with the heart and even heart attacks. And then again, another typical example of where we would use this sort of studies is to look at the narrowing of vessels, to look at the plaque that builds up in vessels, and see if we can get information for our surgeons to be able to intervene and clear those atherosclerosis. So that's the area of vascular physiological. So apologies if that was a bit of a rush through. 30 minutes is not a very long time to talk about the whole area of physiological measurement used in healthcare. But I hope that's given you just a touch of a flavour of where we can use measurement to identify a number of functions about how healthy or otherwise our patients are. So we've covered those two broad areas, the vital signs. temperature, blood pressure, heart rate, and oxygenation of blood. And those are things that we see generally in any interaction with healthcare. So in your local doctors, family doctors, in local health clinics, or in major hospitals, those 4 measurements are key to the general well-being of patients. And then today we've looked at 8 examples of specific use of physiological measurement in hospitals. After the break this morning, you've got 3 lectures looking at a little bit more detail of the physics of the eye and the ear and the heart. So I hope that's given you a quick flavour of physiological measurement, a quick introduction. And I'm happy to take any questions people might have now, or I'm around most of the morning, so I can pick questions either now or later. Thank you very much.